you don't think medical gaslighting exists? Here's a genuine conversation I had with a doctor a couple of months ago. Hi, I've got 3 quite concerning symptoms here that I'd like to discuss with you, please. Why are you wearing a mask? Are you poorly? Oh no, I haven't got a cold or anything, but I've got long COVID, so I'm just trying to protect myself and others in like a medical setting. Right, okay. The first symptom I'm a little bit concerned about is that I've had blood in my stool for a couple of weeks. Have you got any family history of colon cancer or anything? Oh no, I haven't. Well, for someone your age to have colon cancer is quite rare, so you don't need to worry about that. Oh, it's just like I just want to get it checked out because I'm quite concerned about it. Well, you should only be concerned about it if you've got other symptoms too. Right, and what other symptoms are they? If you've lost all your appetite and you've lost a significant amount of weight, or you're very fatigued. Yeah, you know, I've got all 3 of those symptoms, yeah. But that's probably the long COVID, isn't it? I don't know. I don't know. That's why I'm here to see you. Right. Could I just get it checked out, please? If you really want me to. Okay, and my other symptoms is like related to POTS. POTS? Yeah, like I get really dizzy and lightheaded when I stand and my heart rate goes up. POTS has nothing to do with heart rate. It's all to do with your blood pressure. Okay, well, can we investigate that then further, please? I think you should just drink a bit more water. No, I do drink a lot of water because my third point out of all of this is like I get really bad kidney pain, so like I feel like drinking water is really important. Or maybe you're drinking too much water then. Don't know. Where is the kidney pain? Just like here. Yeah, that's not kidney pain, that's musculoskeletal. Okay, so is there anything that can be done about any of these? No, I don't think there's anything to worry about. Okay, bye. Bye.
That was pretty bad, wasn't it? Stuff like that is probably going to happen all the time in every healthcare system, in every healthcare service all around the world. And it's really bad and it's really sad. And I think a lot of it is probably boiling down to communication. And probably other stressors and other factors that are probably influencing the way that the doctor might be running their clinic that day, or even just running that consultation. I'm sure there's probably going to have been times over the last decade when patients have walked out of my room and not felt entirely happy with either the things that I've said or the things that I've done. Obviously, everyone has their own agenda when they're coming in and they have things that they are worried about. I try to ask the patient, what is the thing that they are most concerned about with this, so I can tackle it head on. I often also ask if they've Googled their symptoms, if there's anything that's been flagged up that they want me to address. But it's all about communication and something called ICE, so ideas, concerns, expectations. So we say, what do you think could be going on? What are you worried about? And what are you hoping that we do today? And that kind of hopefully leads to us having a much better consultation, because then the patient feels heard at the end of the day.